Okay, let's get started. Welcome, everyone. It is my absolute pleasure to welcome Dr. Lyndsey Burton here to speak with us today. Lyndsey is the Worldwide Healthcare and Life Sciences Physician Lead at Amazon Web Services. She is a board-certified radiologist and an affiliate assistant professor of radiology at the University of Washington. Dr. Burton has 17 plus years of healthcare experience, including clinical practice and informatics. She's passionate about helping healthcare and life sciences companies innovate using the cloud. Prior to AWS, she was the medical director of Eversana, where she oversaw data analytics for Havas Health and shaped their go-to-market strategy for 70 plus pharmaceutical and medical device brands. Lyndsey advised digital health and radiology AI startups, which have been acquired or received FDA approval. She's served as an attending physician in academics, private practice, and teleradiology after completing residency at Lyndsey Health and fellowship at UCLA. And so it's wonderful to have Dr. Burton here. And I encourage you to put any questions that you might have into the chat, and we'll have some time towards the end to get to them. So thank you all of you for being here, and mostly to Dr. Burton. I'll let you take it away.
Yeah, thank you, Dr. Chan. I'm excited to be here. And what I'm going to be talking to you guys about, I'm going to go over a little bit about AWS, and then we'll do some questions and then some open Q&A after. So title of my presentation is Leveraging the Cloud for Healthcare and Life Sciences. And so starting out, everyone knows that Jeff Bezos was the founder of Amazon, and he built Amazon based on 3 big ideas that we've actually stuck with for the past more than 20 years. And these big ideas are always put the customer first. For every customer we work with, we're very customer centric, and we take the customer and we work backwards from whatever the customer needs to solve their problems and figure out how technology can help them. And the second thing is to invent on behalf of our customers. And if you want to be inventive, you have to be willing to fail. And so there's many times that we failed, but we quickly discover why we're failing and we fix it immediately. And then the third thing is to be patient with the outcome. And that's allowed us to be stubborn on our vision, but flexible in the details. So our view at Amazon is if we remain obsessed with our customers, understand them and their business as well as they do, we can help innovate in collaboration with them and take their business to the next level. So for the agenda today, so we'll go over a little bit more on AWS background. Then I'm going to cover some healthcare industry challenges and growth drivers, and then some of our AWS healthcare initiatives, and then open up to questions. So AWS is the cloud computing arm of Amazon. Both Amazon and AWS are very involved in healthcare and life sciences. Our companies operate independently, and my expertise is on the AWS side. So that's what I'll be discussing today, is just related to AWS. And if you guys have questions about Amazon specific entities, you can reach out and I can put you in touch with the correct people at Amazon, and yeah, not AWS, but I'm happy to field any questions related to AWS. So for some background, security is absolutely crucial for AWS. We take data privacy very, very seriously, and maintaining customer trust, it's an ongoing commitment. And so for our data security, we have for healthcare data security, and I'll get a little bit more into security too as we go further, but just for data protection regulations, we have over 131 HIPAA eligible services, 137 high trust certified services. We have HIPAA reference architecture for quick start deployment, so our customers can make sure that they can take our HIPAA eligible services and make them HIPAA compliant with their data. And for all of our customers too, we get questions a lot on what Amazon AWS does with the data. We don't access or use any of our customer data for any purpose, and customers get to choose. They have full control of their data. They get to choose where the data is, where it's going to be stored, what content, and we don't have access to it. And as you probably have known, AWS Cloud has been around for about 15 years, but what a lot of people didn't realize is that we've actually had a dedicated healthcare and life sciences practice for the past 8 years that we've continued to develop. And these are just some of our growing healthcare and life sciences network customers. So the way that we're set up with healthcare and life sciences, so under our healthcare division, we have both like payers, so our insurance companies and our providers, which includes healthcare systems, physicians, nurses, all of that's under provider. And then we also have all the health tech companies. And then under life sciences, we have pharmaceuticals and medical devices. And then we also have genomics that's also included in the healthcare and life sciences umbrella. And for our global industry challenges, these are across the world. We're experiencing a lot of the same problems with healthcare. And this list was actually put together just before the pandemic. And so some of these major problems with, an aging population, a workforce gap. I mean, we're even seeing this workforce gap in the US. We have a shortage of nurses, and it's a huge problem. And, we're going to have a huge shortage of doctors and nurses in the next, decade. And then as far as the increasing volume of digital data, I mean, it's just enormous. And if you look at this 163 zettabytes, a zettabyte is 1 billion terabytes. And so there's just so much data generated, and, clinicians don't even know what to do with all this data. And then there's also this huge drive to improve efficiency. Hospitals want they basically want everything to operate as efficiently as possible and good profit margins. And they're always looking for ways to increase operational efficiency. And then as far as security breaches, I mean, I was shocked that it's 93% of healthcare organizations have had some kind of data breach in the past 5 years. And again, this is international data. And although digital transformation was accelerated by the pandemic, we still have a long ways to go. So we'll get into some more of the challenges. So what these are our global healthcare trends and growth drivers. And so this is where our healthcare customers are spending their digital health budgets. And so to come up with this list, we basically segmented the market using categories from the WHO and then cross-referenced to international healthcare finance data to estimate the global spend of 2023. And so what this chart is showing, it's showing the total available spend in billions along the bottom, and then the growth rate up on the side on the y-axis. And so, on this, there are about 30 major categories, and the largest opportunities right now are in genomics at like 9.6 billion, electronic health records at 9.4 billion, and telehealth at 6 billion. And then the fastest growing area is actually clinical analytics. And so that's a 34% growth rate of clinical analytics. And so jumping into a few of our healthcare initiatives. So at AWS, we have our own healthcare initiatives, but we also support all the healthcare initiatives of our customers. And as you saw, we work with a lot of different customers. So this is just a sampling of some of our initiatives. And so a few that I'm going to give you guys examples of, just general categories, is modernization using the cloud. And then the two main categories, I mean, there's so many ways we can modernize using the cloud, but the two main examples I'll focus on here are electronic health records and medical imaging. And then there's this huge push for personalization in healthcare right now. Everyone wants to feel that healthcare is specific for them, that their treatment is catered to who they are as a person. And then health equity is huge in healthcare right now. Every organization we work with is focused on how they can make health equity better, whether it's democratization of healthcare, easier access to services. I mean, everyone's focused on that now for good reason. And then leveraging AI and ML. The main areas we see this in are for clinical decision support and automating business processes. So first one, so modernization using the cloud. So Epic is basically it's an electronic health records company that has the largest market share in the US. So they have about 29% of US hospitals, 39% of acute care beds, and more than 250 million patient records across North America. And so Epic is moving onto the cloud. So we now have Epic on AWS, and there's Willforce is probably the largest healthcare system that's using them right now. So they're going to be doing their go live in April, and then the next one will be Piedmont sometime in Q2, and then we have other customers, non-referenceable, but large academic medical centers in Los Angeles, another 7 hospital network in Ontario. So as you see, so the trend is definitely moving towards getting electronic health records onto cloud. Again, early stages, but we're getting there. And then medical imaging on cloud is actually one of my passion areas. I'm a radiologist, and just seeing what we can do with data on cloud is huge. And so we work with most of the major vendors for medical imaging and PACS. The one that I want to focus on here, though, is Visage imaging. So Visage is 100% on cloud, and they have now they have contracts with UC Health, or University of California Health System, so huge hospitals, and they've just done a go live. They've basically taken all the on-premise servers at the hospital, and then they switched them all to on cloud Visage, and they've done this at UCSF and UC Irvine now, and both places were just very, very good feedback. They said some of the customer quotes were that was the best go live ever, which you never hear in hospital implementation. So this is like a really good sign. And so far it's going well. So a great sign that PACS systems are moving onto the cloud. There's a huge amount of data in radiology. And then the next category I want to talk a little bit about is personalization in healthcare. So physicians and nurses often collect our healthcare data, but they're not given the opportunity to gain meaningful insights from the data. Occasionally, some places are, but the majority aren't right now. And so healthcare data just continues to increase in volume, variety, and velocity. And so physicians want to use this data to basically catch diseases earlier and better manage and treat their patients. And then patients want shared decision-making and to be seen as the person in front of their doctor, not just the data in front of a screen. And so, right now we have ambient voice technologies to support clinician workflows, and also machine learning based clinical decision support systems. And so technology is starting to bring together care teams and their patients. But again, with everything in healthcare, you'll see we still have a ways to go. But here's an example. So Change Healthcare is one of the largest healthcare transaction networks in the United States. And so with AWS, they created a data science as a service. It's basically a secure managed healthcare data science platform that integrates social determinants of health with all of their healthcare claims data. And so this provides more robust data analytics capabilities, particularly for underserved and vulnerable populations. And why this is important, more than 80% of our health and well-being is affected by social determinants of health. And these social determinants of health include everything from economic stability to education, geospatial proximity to services, and healthy food. And then another example, more from the genomics side, is GRAIL for personalization. So they're basically using cutting edge genomics and machine learning technology to identify cancer by looking at DNA fragments or nucleic acids in the blood. And so this is what cancer cells will shed into the bloodstream. And so through just a simple blood test, they can detect more than 50 different cancer types, and their false positive rates are less than 1%. And then they can also identify the location in the body where the cancer is with 93% accuracy. And so why this is a big deal is because cancer is often diagnosed late stage when it's metastatic, and it's rarely curable at that point. Only about 20% of late stage patients diagnosed live more than 5 years. So diagnosing cancer early, before it's even symptomatic, has a much better prognosis. More than 90% of patients diagnosed early live more than 5 years. And so the next category initiative is health equity. And so we have a few different ways that AWS and our partners are working to increase health equity. And so AWS has 13 cloud innovation centers, but this is the first one in an academic medical center. So this is at UC Davis. And Together, we're going to explore difficult issues around providing equitable care to a diverse patient population by addressing issues around remote patient care, bias in AI models, transportation, and mental health. And so this will be a combination of, you'll have technical support from AWS, you'll have researchers at UC Davis, you'll have medical students, doctors, nurses. You're going to have a whole continuum of people working together to try to solve these problems. Two other areas that AWS is working for health equity. So Amazon Sagemaker it's basically a fully managed service that enables data scientists and developers to build, train, and deploy machine learning models at scale. So understanding the predictions made by machine learning models and their potential biases, it remains challenging and pretty labor-intensive task, and it really depends on the application, the data set, and the specific model being used. So what Amazon Sagemaker Clarify does is it's an explainability feature for Sagemaker, and what it does is it provides insights into data and machine learning models by identifying the biases and then explaining the predictions. So that's a great start. Again, something we're still working on, but it's a great start to figure out where are these biases or what are these biases in our data. And then this one on the bottom right, so this is Amazon Sagemaker Studio Lab. And so this is an example of democratization. Studio Lab, it's basically a free machine learning development environment that provides compute, storage, and security for anyone to learn and experiment with machine learning. All you need to get started is a valid email address. You don't need to configure an infrastructure or manage an identity or access. And you don't even need to sign up for an AWS account, and you can play around with machine learning models here. So those are two examples of what AWS does. And this is an example of democratization of one of our customers. So what Butterfly did is they created this handheld whole body ultrasound powered by a silicon chip, and it connects to a smartphone. And so why this is a big deal is a normal ultrasound in a hospital costs about $150,000 per unit to buy. In addition, what you need is an ultrasound tech has training, is an experience, knows how to use the machine, and to take measurements and figure out what's going on with the patient. Then you also need a radiologist. So you need a physician who's trained to interpret the images. And so it's a pretty expensive process when you're in the hospital. What Butterfly has done with this handheld ultrasound is it's only $2,000, and you can plug it into your iPhone. And so they also use deep learning models trained on AWS to guide less experienced users. And so if you're not really comfortable using ultrasound, you have guidance from Butterfly so that they can actually make the best diagnosis possible. They can interpret their captured images, and they also help the user even hold the probe in the right direction, make more consistent measurements. And so, this is exciting because again, not everyone has a phone, but if you take something that used to cost $150,000 plus needed really experienced training, and now you've made it $2,000 and you don't need the same amount of training, it's really going to help get to other areas in the world. And then this is another initiative this is the AWS Health Equity program. And so over the next 3 years, AWS is committing $40 million to harness the power of the cloud to advance health equity globally. And so they're offering promotional credits and technical expertise to selected institutions and companies who are addressing health disparities that impact underserved or underrepresented communities around the world. So in case any of you are interested in applying for this, I have the link at the bottom here, but feel free to reach out if you want me to send you, the application in case your companies are working on this. AWS would love to support it. Then another area is leveraging AI and ML. And so some examples of this, we have lots of examples, but just a few just to touch on here. So Houston Methodist Hospital began working with AWS last year. They have over 1.3 million clinic visits and more than 89,000 surgeries per year. And what they wanted to do is they wanted to use automatic speech recognition technology to create contactless solutions to improve patient safety and experiences. And so another thing that they also wanted to do was help clinicians spend less time in front of the electronic health records. And so what they did is they used they basically use voice automation and natural language processing to simplify tasks and automatically capture data and transform the clinical workflow. And so they now have a solution that allows surgeons and support staff to interact with a digital voice assistant before, during, and after surgeries. And yeah, this has actually been really popular. It can also be used when a doctor is doing an exam on a patient in the exam room. They don't even have to type an EHR note. It can just listen to what the doctor is saying to the patient and then create a note for the doctor to put into the chart. So lots of cool stuff with voice technology. And then I think this one's super exciting. So I know the text is small, but I'll kind of explain this one to you guys. So typically designing, we've all heard of Moderna, and typically when designing mRNA-based therapies, there can be multiple mRNA sequences and structures that can be produced. And so synthesizing and testing each option to determine which is the most stable and easiest to chemically develop is very costly and time consuming. And so Moderna reached out to AWS, and they utilized our drug design studio and digital biotechnology platform. And so the machine learning models from this basically, they made learning sets to predict the best mRNA structures for production. And that's how we got, our great vaccine with Moderna. And the other things that AWS was able to do is they scaled the manufacturing and supply chain capabilities to be ready for, this massive vaccine distribution. And so together with the manufacturing and, the mRNA platform, they were able to basically deliver the first batch of their vaccine candidate in 42 days after the initial sequencing of the virus. I mean, that's just unheard of, that together working with, pharmaceutical industry and tech, were able to make really, really big things happen. And, they've also brought a Zika vaccine from just an idea to clinical trial in 1 year. So really, really great technology going forward with that. And then this is another, cool one. I'll end on this one, but in the past, if you've got a colonoscopy, for, I guess, anyone who's 45 and older might be familiar with this. So normally you have to do a prep, and you have to go to the hospital. You have to have some anesthesia, and they do a scope, and there's lots of recovery time. And so what Medtronic has created with AWS supporting them is they created a pill cam. And so basically from your own home, your doctor can send in the order, they mail it to you, you get it the next day, and you swallow the pill cam, and it takes images. And so the reason I put this in the ML AI category is because as the pill is going through the GI tract, it actually uses AI to analyze the images to look for polyps. And so any image it sees that has like a polyp or an abnormal finding, it will flag, and it will then send to a gastroenterologist who will review the images and decide, the next management for the patient. And so, I think this is super, super exciting, because the patient will get the results. You don't have to leave your home. And yeah, I just thought that was a very, very cool example of what you can do. And then if you guys want any additional information on AWS for health, I just put this slide just so you have the link. I know this talk is a bit, well, it's actually a lot more healthcare focused. I wanted to cover everything for you guys, from healthcare to life sciences to genomics, and there's just so much information. It's hard to cover everything, but if you want to check out the site, it goes through a lot of our genomic solutions and our life sciences solutions. And again, I'm always happy to answer other questions offline as well. All right. So that's the conclusion of this portion. So then I guess next is, we'll move to some Q&A.
Great. Thank you so much for that overview. And it is amazing to see how many different things are going on at AWS just within the healthcare space. And I know you just started to scratch the surface. So I know Bianca wrote this in the chat, but I welcome people to write questions in the Q&A box. I'm going to start with a couple of questions that I have, and then we'll open it up to the broader audience. Maybe just to start at a high level, there have been a lot of efforts by big tech to enter into the healthcare space. And most of those ventures have had limited or, I dare say, if any, impact. And so I was curious if you could share why you think this might be and what role do you think big tech will have in the healthcare space going forward?
Yeah, sure. It's a great question. In the past, like I've been in healthcare for 17 years, still practicing, and you see a lot of different stuff. But just to kind of give you some context, in the past, like healthcare has always been less receptive to change and new technology compared to other industries. When I was an intern, I mean, this wasn't that long ago. It was like 2009 to 2010. We're still writing paper notes for patients in binders. We didn't even have electronic health records then. And even in 2022, outside records are still faxed. Doctors still carry pagers, and radiology images are provided to patients on a CD. I mean, who even has CD players anymore? So, it's definitely different than other industries. And so for many stakeholders, the system worked, and there really wasn't as much incentive to change. And so then the pandemic came. And so the pandemic was really a catalyst for necessary change to bring the public and private sectors together. And so some ways that the technology was able to help, and this made hospital systems look at technology a little differently. But they were able to support vaccine development, as we just talked about, in rollouts. They were able to aggregate all the New York State COVID-19 data. It came from like 6 different health exchanges, and they were able to help New York. Like we saw that great data coming out of New York City with tracking COVID rates, and they were able to aggregate that data and help the state to inform their response of where hospitals were full, like where they needed to provide more support. And then, we've also done things like scaling telemedicine services, creating virtual assistants to take the burden off the ED, and, chatbots to screen vulnerable patients and connect them with social services during the pandemic. So there's been a lot that technology has been able to do during the pandemic. And, at the same time that hospitals are becoming like more receptive to technology, I think that patients now, they really expect tech solutions in healthcare. I mean, patients, are used to turning on Netflix and watching whatever they want, whenever they want it. And they're used to requesting like Lyft and Uber, and you have a car there immediately, like whenever you need it. And I think they start to expect that in healthcare. So now it's not only that hospitals, healthcare orgs are coming around to cloud. I think it's also that patients are expecting and demanding, virtual care, personalization. And, so I think all of that on that side, I think that the timing is better now. I think that people are more receptive. And then the other good part about this is, over the last 8 years, AWS has been able to like further develop their cloud services. Like we have a lot of experience in regulated industries, and they've been able to further develop cloud services that are specific for healthcare and life sciences companies. And so you asked about I know this is kind of a lot for this question, but I think it all kind of ties together. It's multifactorial, but I think the role that big tech or what AWS is going to play in the future is, I think we're going to continue supporting our customers and helping them innovate using the cloud. I'm confident that this time around we're going to succeed because, we do have the 15 years of cloud experience with highly regulated industries. And we're also hiring industry experts now. One of the reasons that I joined AWS was because all of the physicians that AWS hires, they all have significant experience, significant clinical experience. They've been practicing doctors, have worked, in hospitals, taking care of patients, but they've also had significant industry experience. And so why that's important is that we understand the healthcare challenges and pain points, and then we can work backwards from our customers to figure out how technology can support them. So this time around, I think it will be better. So.
Great. So I think one big hurdle that often arises in healthcare analytics and data and informatics is the siloed nature of the industry and the fact that there's a real lack of interoperability of the different data systems out there. So what do you see as the potential role of cloud computing providers such as AWS in breaking down these barriers?
Yeah, so yeah, the interoperability is a huge issue. So where AWS can help is, we're really committed to open standards and published APIs. And so this puts us in the unique position to basically act as a hub and integrate with existing systems. And so we're able to leverage our native like AWS tools, or we can actually also leverage our deep relationship with all the major integration engines as well. And then we can work with our HL7, our FHIR, and our other standards organizations. And so by doing this, we can leverage this position to support and move towards more interoperability. Now, to level set this, it's going to be a long process, and there really aren't easy answers. But I think through openness and working together with the support of the government and industry interoperability standards, as well as our own AWS native tool stack, I think interoperability is achievable.
I like that optimism.
So cautious optimism. I think it's possible, but yeah,
you touched on this a little bit during your presentation, but I was hoping you maybe could expand a little bit more. Privacy is always a concern with personal data, but the stakes are obviously much higher when it comes to personal health information. And so what would you say to people who are naturally skeptical and concerned about their health data being placed on the cloud?
Oh, yeah, for sure. So the first thing I usually tell people who ask me about this is that your data is actually more secure on the cloud than it is on-prem. On-prem is, sorry, I've been throwing that out a lot. It's basically on-premise, on premises, like basically, hospital having all their own servers. And so that's what I mean whenever I say on-prem, but your data is actually more secure on the cloud. So Amazon, AWS, the companies together are both really vigilant about customer privacy. And so we have sophisticated technical and physical measures to prevent unauthorized access. So we basically have this like world-class like security team of experts that are monitoring our systems 24/7 to protect our customer content. And so if somebody's worried that their data is going to get out and someone's going to take it, it absolutely won't, because we will not disclose any customer content in response to requests unless required to do so to comply with like a legally valid and binding order, such as a subpoena or court order. Otherwise, your data is not going anywhere. And even if we do have a subpoena or court order asking for your healthcare data, like we would still notify you before, before disclosing the content so that you can choose what to give them. And so it's also important to point out that customers can choose to encrypt their data themselves, as part of a standard security process for highly sensitive content. So it's not just that AWS has all the security, like you have a separate layer that you can basically encrypt all of your data as well. And so we provide tools that you can use to encrypt your data either at rest or in motion. And you can choose also from a number of like supported third-party security solutions as well. And so any content that's been encrypted is rendered useless without the appropriate decryption keys. And so that's what we think of privacy and security. But then the other important thing about healthcare data, people are again afraid that we're just going to share it. We absolutely do not share any data. AWS customers retain ownership and complete control of any data they have stored in AWS. So I would be perfectly comfortable with any of my healthcare data stored in AWS.
Great. So I'm going to open it up now to audience questions, and I'm going to again invite you in the audience to put them in the Q&A box. Great. So here's a question from Yvonne. She says, "Thank you for taking your time talking with us here. My question is how your medical training and professional experience has helped you lead at Amazon. Can you give an example of such interdisciplinary endeavors?"
Yeah, so I think that the way that all of my medical experience and then I also have the data analytics experience, I think those have been really beneficial because all the customers that we meet with, you have a really good understanding of what their pain points are and like how to help them. So it's also to a different level of trust. If if like a hospital, if you're meeting with a hospital CEO and they know that you've been in the trenches working with them for, the past, 17 years, it's a different level of trust and interest in working together, I think. But it's been really good also having not only the medical experience to really understand pain points and help solve technology issues. It's also, I think, having the data analytics experience has made it even better, so that I can figure out like what insights would be helpful for for healthcare and life sciences customers. And so yeah, I think all of the past experiences, like it's funny because people say that AWS, it's this enormous corporation, but it also, we move very quickly. And so, I used to advise startups. And so, I got the experience of working really fast, doing a bunch of different jobs, but like the speed, bias fraction is another leadership principle. So like all the experiences of, the healthcare experience or background, the data analytics to better understand our customers. And then, working for startups, the speed has actually helped to, it's to move fast at Amazon as well. So everything together is beneficial. And yeah, I saw that there was like one audience question asking about if healthcare experience was necessary to consider a venture or job in healthcare analytics. And yeah, I'll just touch on that briefly now, as I'm kind of talking about why my skills have been important at Amazon. But for anyone else who doesn't have a strong healthcare background, I don't think it prohibits you from going into healthcare if you have a really strong team of people who have deep clinical expertise. So if you don't have much healthcare experience, but you still want to be involved in, healthcare in healthcare business or organization, you can do it, but make sure you build a really, really good team. I do think the more hands-on experience you have, the better.
I guess building the flip side of that, there was a couple of questions also for those for doctors who are interested in getting involved with a company like Amazon or AWS. Kind of so you talked about a lot of the value in doing it, but how do you get your foot in the door in the first place?
So yeah, I can tell you guys a little bit about my story doing that. So the short answer is, I think the easiest place to get a foot in the door is to work with startups or accelerators. Oftentimes they have companies that want to do something cool in healthcare, but they don't have the clinical expertise. And so that's a great area. They're always open to people helping. And so that's like a great area, just kind of get your feet wet and get experience. Yeah, the way that I got into it, in case anyone wants to hear this, but like I started when I was in residency, I was really interested in the business side of medicine. And so I started, it was silly. I started like just going to a bunch of the Harvard Business School events because I was doing residency in Boston and just talking to people. So it was basically just networking. And through that, I met this startup founder, who then introduced me to a company called Kairos. And so I was a clinical consultant for Kairos back when I was in residency, and that just kind of got me interested in what you could do, how you could solve pain points, and just the creative aspect to, business over just clinical medicine. And so, and then, going forward, then when I was in fellowship, there was so much interest in radiology AI, and I wanted to see, like, was it like people were saying it was going to take over radiology, and I wanted to see, was that true? And as we see, it's not going to yet. It's going to support radiology, but so I started advising radiology AI companies, and then yeah, this next story, you guys probably you might not want to follow my advice on this, but after kind of dabbling with a few different startups, I knew I really wanted to pursue a career in business. And so I ended up quitting my job, flying out to the JP Morgan Healthcare Conference, and decided I was going to try to network my way into a business role. And so, yeah, that was, again, if you're living in the West Village in New York City, it's probably not the best idea to quit your job and, fly out to a conference and try to talk your way into it. But, ended up meeting some amazing people there, and that led to, another startup that I worked for, which then led to being recruited to the analytics company where I was medical medical director, and then through there got to AWS. So yeah, so I'd say in summary, startups are a great way, but there's also jobs, if you want to make an impact in healthcare, I mean, there's lots of opportunities. There's government, there's payers, there's hospital administration, there's, tech. And so I would say in general, if you want a job though in big tech, get some industry experience first, because it will definitely help versus coming straight from clinical medicine. So.
Great, thanks. So here's a question from Anthony, who is in the AWS Partner Network, and their platform integrates clinical analytics solutions into electronic health record workflow. What is the best way to partner with AWS to help customers that need clinical analytics integrated into HR workflow to empower clinicians to implement data-driven recommendations and best practices at point of care?
Yes, so that is absolutely fantastic what you're doing. It's so useful for, I mean, you can get insights on patients and yeah, make decisions at the point of care is great. So what you want to do, so continue working with you're already in the partner network. So you're going to want to reach out to whoever your account manager is and let them know that you would like to basically, like what we need to do for you is we need to introduce you to some of our other EHR companies that run on AWS. So just let them know that you'd be interested in meeting some of the EHR companies, or at least meeting some of the other account managers who are the account managers for our other EHR customers. And then they can figure out if your company is a good fit, and then we can do some introductions.
Great. So here's a question from Jessica. Jessica works for a community health system on Long Island, 6 hospitals, 3 nursing homes, 65 physician offices, inpatient, outpatient, et cetera. And they're an Epic shop. And so they have been for 10 years. We use PACS for radiology reads as well. So what is the benefit of moving to Epic via AWS Cloud versus current localized implementation? What are the barriers or downside to migrating to the cloud? Is it marketed for new entrants, or do you also have current Epic customers who are converting?
Okay, so yeah, that's a lot of different questions. Okay, so first, let's talk about the advantages to being on cloud. So if you're able to convert on cloud, you don't have to manage your data center. So your hospital can save money. You can save like up to, I think it's like up to like 30 or 50% on the cost that you're spending on prem, because once you're on cloud, you're no longer managing those data centers. You no longer have to back up any of your data. Like your data is completely secure. And so and there's a lot more redundancy with the cloud. So you have that. You also have the issues of improved performance. You're not going to have downtime. I mean, even if you need to do an update, like in hospitals all the time. I mean, I would be working in radiology overnight and they decide to update the hospital system, and you're the only radiologist covering the hospital. And I mean, it was a horrible time to update a system. But when you're on cloud, it's the updates, you don't really have downtime from them, because they can just put in the new code, and then the next time you click on it, it's going to have the updated, it's going to have the changes. And so that's another big advantage. Also, I think the really cool thing with cloud is that you can then integrate AI and machine learning on it. You can basically use all of the AWS services, and they continue to develop like really great services all the time. And so you're going to be able to basically innovate a lot faster than anyone who's still on-prem. So not only we have better performance, better security, cost is better, but then you'll also have access to figuring out ways to use AI and machine learning in your hospital system. And then for the PACS, a lot of the same advantages, just you use the AI and ML for decision support, but it's also, I mean, it's just the speed of images. And then in the future, I think it's going to be really cool if you have them both on cloud. You'll start to be able to integrate even better your radiology data, your EHR data, and in the future, also your genomics data too. So if you're interested in switching though, feel free to reach out to me after, and I can get you more details, put you in touch with people. Oh, and then the last thing I forgot to mention, our existing AWS customers switching. Yes, people are definitely switching. So we're seeing switching from, so you can be a new customer and switch, or you can be an existing customer, and it's no problem either way. We have specialized teams who help out with that and do that every day.
So here's a question from Reggie Ann. She wanted to know more about the Cloud Innovation Center, and where are the main ideas coming from until now? Is it an open collaboration space or focused on the Davis environment that you spoke about?
So I believe it's, that's a great question. It just launched in November, so I think they're still kind of figuring out a lot. There's a few different cloud innovation centers, and if it's something that you're interested in doing with your institution, you can just check it out. It's on AWS, and you can apply to be a cloud innovation center. So I believe it's within the Davis system, but most of these cloud innovation centers are pretty open. So like, if you have good ideas for what they can do, I'm sure they'd be receptive either on the AWS side or on the Davis side to work together with other institutions. Again, I can't guarantee that because I'm not UC Davis, but usually a lot of these like where they're trying to solve really tough problems, they usually open to collaboration from other people too. So but yeah, if you're interested in learning more, I mean, I can put you in touch with with the account manager for Davis, or you can look up the Cloud Innovation Center application process online too.
Great. I think kind of tying in a couple of questions that are thematically similar, really just trying to understand what you view as the big opportunities in utilizing the cloud, and what aspects about AWS do you feel give AWS an advantage in terms of kind of cloud computing services that might be available?
Yeah, so I think, besides the things that I've mentioned on, performance and security and, AI, ML, I really think that even for the cloud, like we're still early in, again, we've had a cloud for 15 years, so we have a lot of experience, but I still think we're just scratching the surface for what all we can accomplish using the cloud. I really think that in the future, we're going to move towards, I mean, or at least I hope we're going to move towards this. I think we will, but we'll move towards this integration of HR data, radiology data, genomics data, and we're going to get these amazing insights on patients. And so just figuring out like what we can accomplish with that, I think is for me, it's one of the most exciting things about where cloud's going to go in the future. And yeah, so those are like some of the areas that I think are most exciting in what you can do with the cloud. And again, we're developing new services every day. So, we just developed like one for financial analytics, and, we have tons for healthcare and life sciences too. And so every day you're just getting new things that you can do with the cloud. And so I think it's scary for healthcare organizations that are signing up for like new contracts. To say they're signing up for like a new PACS contract now, they're going to be stuck with that PACS system for about 10 to 15 years. And so if they don't get on the cloud now, they're really going to be left behind, because you're going to have these institutions that are switching over to cloud that are doing really amazing things and providing better care for their patients, getting better data. But then, and they won't be able to do that. Why AWS is a great cloud provider. I might be biased, but no, AWS, we have more availability zones, more regions throughout the world than any other cloud provider. We're also the most reliable cloud service. And, we really have the experience in so many highly regulated industries. Like, not only are we doing healthcare and life sciences now, but we have like the Department of Defense, the US Army, Veterans Affairs. We have these like very highly regulated industries, and all the financial institutions. We have like JP Morgan Chase, we have Capital One, we have Goldman Sachs. And so we have lots of highly regulated industries. So, we know how to protect data and keep it safe. And so, I think the experience, the cloud experience that we have, the technical experience, and the industry experience we have from people working there, other physicians, and then also the really exciting things we can do with cloud in the future, I think are the selling points, at least if I was buying cloud.
Great. I think we have time for one last question. Maybe just to wrap up, I know you talked about some companies earlier, but it'd be interesting to hear your thoughts on which companies are really leading the way in the field for cloud adoption in the healthcare space.
Yes. So hands down, it is our startups. So more than 86% of health startups actually build on AWS. And so like we have startups like Babylon, Viz.ai, HeartFlow, Redox, 23andMe. I mean, we have so many startups doing really exciting things, and they're 100% leading the way with cloud. You also have some of our enterprise customers that are doing really cool things with cloud, but again, hands down, the answer, the winner is the startups. But you have things like you have Philips. It's like a well-known healthcare company, and they've moved 37 million patient records onto Amazon Redshift in like 90 minutes. So like you're seeing just the potential of what these basically big organizations, these enterprise healthcare companies can do with the cloud. So, you're seeing lots of exciting stuff happening, but yeah, our startups are really the the ones who are most have most adapted cloud, and our other customers are working on it. They're all in different stages. Some have never done cloud and they're just looking to move on to the cloud for the first time, and others have been on cloud for years and just want to do really amazing, innovative things. So it's a whole spectrum.
Great. And I think we have a couple of people in the audience who are venturing into that startup space and utilizing AWS. So it's really great to hear that's where a lot of the innovation is occurring. With that, I think we're going to just try to wrap up. So thank you so much for your time today, sharing a little bit about what is going on with AWS cloud computing. It's clear that there's a lot more than what we were able to cover today, but it's great to see the innovation that is happening at AWS and where these different opportunities are. And I think you highlighted really well. It really spans the spectrum, and the type of technology that people use is very different in the use cases. So I want to thank you for your time, for being here. Thank you to our audience members for being here as well. I hope everyone has a great day, and hopefully we'll see you at another HPM event in the future.
That's great. Thank you.
Thank you, everyone. Take care.